Hi, everyone. Thanks so much for joining us today for our Wake Up with Wasatch webinar. Today, we have our Director of Recreational Therapy, Adelinn Cook, to present in honor of International Recreational Therapy Month. So she's going to kind of provide an overview of what recreational therapy is and our program at Wasatch Crest. So I will go ahead and hand it over to Adelinn to kick it off.
Thanks so much, Kayla, and thank you to everyone who is joining us today. I appreciate it. Happy International Recreational Therapy Month. In honor of this month, I wanted to do a general overview of recreational therapy. So what it is, what recreational therapists do, who we serve, and a few other things. And I'd just like to note first that this, although it is a comprehensive presentation, it definitely doesn't cover a lot of the things that go into recreational therapy. So it's just going to be more of a general presentation. So I hope you guys enjoy it. So let's start with what recreational therapy is. So recreational therapy is a systematic process that utilizes recreation and other activity-based interventions to address the assessed needs of individuals with illnesses or disabling conditions as a means to psychological and physical health, recovery, and well-being. Recreational therapy is also known as therapeutic recreation, and it is a treatment service designed to restore, remediate, and rehabilitate a person's level of functioning and independence in life activities to promote health and wellness, and reduce or eliminate the activity limitations and restrictions to participation in life situations that are caused by an illness or disabling condition. The purpose of recreational therapy is to improve and maintain physical, cognitive, social, emotional, and spiritual functioning in order to facilitate full participation in life. Recreational therapists use a person-centered approach to therapy where recreation, experiential-based interventions, and psychoeducational processes are the primary treatment modalities. Recreational therapists use recreation and leisure-based activities, for example, art, music, sports, games, nature, relaxation, etc., to provide developmentally appropriate support to patients and their families, to assist in the improvement of the patient's emotional, social, physical, spiritual, and cognitive well-being, to help identify, develop, and improve a patient's functional abilities and independence, to decrease or eliminate barriers to successful participation in recreation and leisure activities, to explore and develop positive coping skills, work on community reintegration, and help transition patients from a care setting to develop a healthy leisure lifestyle that supports continued recovery, improved health, and greater quality of life. A lot of different kinds of people benefit from recreational therapy. Some of these people include individuals who could benefit from the tools and support that improve quality of life, people who have low participation and engagement in their lives and community, individuals who have internal, external, or system barriers to participation and engagement, individuals who could benefit from interventions that modify their level of functioning, people that need modifications of leisure activities so they can still participate, people who need assistance in choosing attainable alternative leisure activities that aligned with their established interests and benefits. And then rec therapy could also benefit people who need assistance in the discovery of alternative interests and the acquisition of new skills. So why does recreational therapy matter? Rec therapy matters because it really embraces an emphasis on health, which includes not just the absence of an illness, but the enhancement of the physical, cognitive, emotional, social, and spiritual, and also leisure development. It uses recreational modalities in the designed intervention strategies. Rec therapy is extremely individualized to each person by his or her past, present, and future interests and lifestyle. Rec therapy also incorporates the client's interests, family, and/or community to make the process of therapy meaningful and relevant. Recreational therapists have a very unique perspective regarding the social, cognitive, physical, spiritual, and leisure needs of the patient. And then recreational therapists weave the concept of healthy living into treatment to ensure not only improved functioning, but also to enhance independence and successful involvement in all aspects of life. Recreational therapy is very unique for a lot of different reasons. First, it uses a holistic approach to improve functioning and enhance independence. It uses evidence-based interventions to reach the assessed outcomes. It incorporates the client's interests, family, and community to make the therapy process meaningful and relevant. And it teaches lifelong skills to improve quality of life. So in the holistic approach of recreational therapy, we have the expertise to assist individuals coping with the stress of an illness or disability through leisure and recreation-based treatment options. The recreational therapist empowers clients to manage their illness and/or disability so they can achieve and maintain optimal levels of independence, productivity, well-being, and quality of life. And here's the 8 dimensions of wellness often used by recreational therapists to make sure that we are providing holistic care. As healthcare providers, recreational therapists have to stay up to date on current research and best practices and update our clinical approaches and interventions accordingly. This requires the consistent reading of journal articles related to one's area of practice, reflective thought regarding the findings, and the incorporation of the findings as appropriate into clinical practice. Here is an example of some of the research that we use to incorporate into the client's treatment. Recreational therapy is also person-centered. We approach treatment with the perspective that the whole person should be considered. So for example, we ask questions like, what does this person like to do for fun? What does this person's familial or social support look like? Where does this person live? What resources are available to them? What are the person's religious or spiritual beliefs? What are the person's physical, cognitive, emotional, or social limitations? And then what adaptations or modifications does this person need to participate fully in life's activities? So this is an example of one of the models that we use. It is the International Classification of Functioning, Disability, and Health developed by the World Health Organization. This model looks at health not just from the perspective of disease, disorder, or injury, but from the perspective of how a person's health fits in with the rest of their life, the kinds of things that they like to do, and the environment that they live in. Recreational therapy has a lasting effect. What we do is we teach clients and our patients lifelong skills to improve their quality of life. When individuals are suffering from a physical injury or mental illness, not only do they need help learning how to live with their disability, but they need to know how to enhance their quality of life by reducing the isolation they may experience, and they need to know how to successfully participate in leisure activities. Recreational therapists work in a lot of different settings with a variety of populations. Recreational therapists serve individuals of all ages and abilities. Some common populations include people with mental health and substance use disorders, people with intellectual disabilities, physical disabilities, neurological disabilities, and then cognitive and learning disabilities. Recreational therapists work in settings such as hospitals like the VA, behavioral, pediatric, and rehab hospitals, skilled nursing facilities, residential treatment centers, school systems, group homes and long-term care facilities, outpatient services, correctional facilities, and then community parks and recreation. And then I'll go over the education requirements, qualifications, and certifications needed to become a recreational therapist. So the academic pathway for recreational therapists include obtaining a bachelor's degree or higher in recreational therapy or therapeutic recreation from an accredited university. Here, there's an emphasis on coursework in the physical, biological, and behavioral sciences, including recreation and leisure theory. From there, Students are required to complete a formal internship, a minimum of 14 weeks and 560 hours under the supervision of a certified therapeutic recreation specialist. From there, the student passes a certification exam through the NCTRC, and from there, they are nationally certified as a certified therapeutic recreation specialist. And then we have to maintain that credential every 5 years through the NCTRC recertification process and obtain CEUs. Currently, there are the following states that require recreational therapists to obtain licenses. These are Utah, New Hampshire, North Carolina. The newest one is New Jersey, Oklahoma, and Washington, D.C. So what this does is requiring licenses for recreational therapists. It helps protect the consumer to make sure that the clients are receiving the best possible practice. So the certification process, students have to meet eligibility requirements and pass a knowledge-based exam. CTRS is the evidence that the individual, through education and experience, has met the NCTRC certification standards. Recreational therapists are accredited through a lot of different agencies. A couple of these include the National Council for Therapeutic Recreation Certification, the Centers for Medicare and Medicaid, Joint Commission, the Commission on Accreditation of Rehabilitation Facilities, and the Individuals with Disabilities Education Act. So the service delivery model for recreational therapy is assessment, planning, implementation, evaluation, and documentation. We use this systematic process to improve the general health and well-being of people with illnesses, injuries, and disabilities. So first is assessment. Recreational therapists use appropriate instruments or batteries to generate diagnostically appropriate baseline data that identifies the patient's strengths and limitations in functional areas: physical, cognitive, social, behavioral, emotional, spiritual, and leisure. Recreational therapists utilize these assessment procedures: structured interview, direct observation, performance testing, information gathering from other treatment team members, and record review. And this is an example of an assessment created by the World Health Organization. The next step in the systematic process is planning. Recreational therapists interpret assessment data to develop an individualized treatment plan that includes relevant short-term, long-term, and discharge goals. All factors are considered, so the client's diagnosis, any precautions or contraindications when we're developing the treatment plan. Recreational therapists collaborate with the patient, sometimes their family, other team members, and consultants in the development of the treatment plan. Implementation is next, and probably the most fun part of being a recreational therapist. These implementation strategies are based upon the assessment and treatment plan, and they include the type, frequency, duration, and intensity of interventions needed to achieve expected outcomes. Recreational therapists consistently review, modify, or discontinue rec therapy interventions based upon patient progress or change in their condition. And evaluation. Recreational therapists conduct formative evaluations of the patient's progress that are based upon their treatment goals, reviews of the intervention strategies, and consideration of patient satisfaction and functional outcomes. From there, a summative evaluation of patient progress is made that determines the effectiveness of the treatment plan. So this is where progress notes come in, collaborative team meetings, and patient reports. And then lastly is documentation. So at the end of each session or intervention, written documentation is completed to note individual successes and ways for the patient to continue to improve and work on their skills following treatment. Rec therapists also develop and document discharge plans in order to summarize the patient's response to treatment and then note recommendations for continued services to meet the patient's specific needs. So interventions and initiatives. I have just a few examples of interventions, modalities, and initiatives that recreational therapists use. Some of these include leisure education, aquatic therapy, therapeutic play, animal-assisted therapy, adaptive sports, experiential therapy, expressive therapy, anger, stress, and pain management, cognitive stimulation, community reintegration, relaxation therapy, horticulture therapy, bibliotherapy, and adventure therapy. This is an example of an intervention outline. Recreational therapists have a very structured way of implementing modalities and interventions. So it's always good to identify the objectives and suggested learning comes of an initiative, resource and materials needed, space required, group size, how long it's going to take to facilitate the group, and then the facilitation format. A big part of recreational therapy is the processing discussion afterwards. So we do an activity and then we relate it back to whatever life experiences. And then always recreational therapists look at any variations of the activity to make it easier or more difficult for the group or the individual. And then we have to make sure that adaptations or modifications are available for people depending on their disabilities. So I'm going to go over some common outcomes of recreational therapy. Some of these include physical functioning, such as improved balance and coordination, agility, gross and fine motor skills, mobility, endurance, strength, and flexibility. Recreational therapists also see outcomes in social functioning, such as conversation and communication skills, assertive communication skills, cooperation, competition, social cues and manners, and interpersonal skills. As for cognitive functioning, some improved outcomes include attention span, problem solving, decision making, comprehension, sequencing, and following instructions. Also improved emotional functioning, so an improvement in resiliency, emotional regulation, an improved mood, self-esteem, decreased anxiety and depression, and then pain, stress, and anger management. So I'm going to go over a couple of models for recreational therapy practice. This is the leisure ability model, and essentially the idea is that the needs of the clients start to decrease the longer that they are engaging in recreational and leisure activities, and then the role of the recreational therapist kind of lessens the more independent they become in their leisure activities. So the leisure ability model is based upon the concepts of internal locus of control, intrinsic motivation, personal causality, freedom of choice, and flow. It uses treatment, leisure education, and recreation participation as the basis for service. The overall intended outcome of rec therapy services, as defined by this model, is a satisfying, independent, and freely chosen leisure lifestyle. Assumptions for this model include every individual has a right to leisure, many individuals experience barriers to participation in leisure, and then individuals with disabilities face more frequent barriers to leisure. Another common model is the health protection, health promotion model. A very similar concept here. As the client progresses in treatment, they start out with a small locus of control and it is more therapist directed. As they reach stability, the recreational therapist role kind of narrows and then the treatment becomes a little more client directed. The health protection, health promotion model assists people in recovering from threats to health, health protection, and to achieve a high level of health, as high level of health as possible, and this is health promotion. The basic themes here is health, wellness, stabilization, and actualization. It is based upon the humanistic perspective. And the idea is that as an individual restores and regains the stability to health by using recreation and leisure as a tool, the role of the recreational therapist narrows and the individual gains independence and leisure participation. Assumptions for this model include activity, recreation, and leisure interventions facilitate an individual's movement towards high levels of health and wellness, and that people are motivated by stabilizing tendencies for managing stress and actualizing tendencies for seeking growth and health. Recreational therapists often work within an interdisciplinary treatment team. Recreational therapy is great at complementing other scopes of practice because it provides a comprehensive and holistic approach to treatment that encourages growth and progress in many life domains. Rec therapy complements goals and objectives set with other members of the treatment team. So we work with the doctors, clinical therapists, occupational and physical therapists, etc. And then we offer unique modalities to improve functioning. So I have an example of continuity of care. Say a recreational therapist was going to facilitate a community outing for patients with physical and cognitive disabilities. And say the treatment team consisted of a recreational therapist and an occupational therapist. Here, the recreational therapist would work on goal setting with the patient to address their physical and emotional barriers. So we would talk with the client about, if they're using a wheelchair, how to navigate through doors, how to deal with crosswalks and traffic, curb cuts, how to appropriately interact in social situations, how to use assertive communication skills, etc. And then the occupational therapist on the outing might help with things like activities of daily living, so getting dressed, bathroom mobility, eating, etc. And that is about it. To summarize, recreational therapy is comprehensive, evidence-based, systematic, effective, health-focused, nationally recognized and accredited, inclusive, versatile, person-centered, meaningful, relevant, complementary, holistic, fun, purposeful, and optimistic. Thank you guys so much for joining me for my presentation today. I wanted to give a special thanks to Anna Martin, Christina Hayden, and Ethan Pickett for their intellectual and visual contributions to this presentation. Thank you guys, and happy International Recreational Therapy Month.
Thank you, Adelinn. That was great. Your GoToWebinar control panel, so feel free to take those with you. And then our next webinar is going to be on February 26th on service and treatment and recovery. So look out for an invite for that. Thank you, everyone.
Thank you, Kayla.